Hello, everybody. This is Don Resnick, and we are today starting a new series of lectures sponsored by Educational Symposia. These will deal with disorders of human articulations with an emphasis on synovial joints. I'm giving this lecture from my home in Del Mar. Here is a picture of it just to show you. And this is my front door. Here is a look into my house. And here are the topics that we'll be covering over a series of about a dozen lectures. You can see at the beginning, the two-part lecture. We'll give the first part today dealing with basic anatomy of human articulations. We're going to follow that with a discussion of certain disorders of synovial joints, emphasizing morphology and distribution. We'll then talk about specific types of articular diseases, rheumatoid, crystal osteoarthrosis, infections, traumatic disorders of synovial joints. And we'll finish up the series of lectures by talking about tumors and tumor-like lesions that involve joints or nearby bone, and end with a discussion of articular diseases of the vertebral column. The first part of this particular discussion will deal with basic anatomy, and I'll give you an idea of what we will be talking about. There are two general objectives for this particular lecture. We're going to review the various types of human articulations. We'll do so fairly quickly. We'll talk about fibrous, cartilaginous, and especially synovial joint anatomy. We'll then spend the rest of this lecture talking about some of the many components that are found within synovial joints, including menisci, discs, tendons, and ligaments. When you look at the history through the many, many years that people have been interested in the articulations of the human skeleton, there have been many different patterns of classifying these joints. The two basic ones that are used most commonly are classification based on function and a classification based on structure. Now, I've looked at both of these, but I favor the one that appears in Gray's Anatomy based on structure. This is a picture of my book, the Gray's Anatomy book that I have in my home office, from which I am lecturing. And I would emphasize it's the British edition. I think that is better than the American edition. This is not the newest one, but it's the one I use. And you can see from this particular slide and picture, I've used it quite a lot. If you, in fact, refer to this particular book, you will. Good morning, everybody. And here again, I'm lecturing from my home. Again, the topic of this particular presentation is human articulations and related structures, basic anatomy. Hopefully, those of you with a good memory will recall that we already covered part A, and my job today is to move on and to part B. To give you an idea of what I plan to cover over the next 60 minutes, I have two major objectives for this part, shown at the bottom of this slide. Number one, to investigate a variety of abnormal fluid collections, including things such as effusions, hemarthroses, lipohemarthroses, various types of cysts, bursitis, and tenosynovitis. And then the second objective, to describe at the end or toward the end some miscellaneous abnormalities that involve joints, particularly synovial joints, adhesive capsulitis, synovial plica, and intra-articular bodies. So let's begin this particular presentation with the first part. We're going to be talking about abnormal fluid collections. Okay, so let's start with joint effusions. Generally, in almost all synovial joints, there is physiologic amount of fluid, and it's generally measured in a few milliliters. Perhaps in larger joints that reaches 5 milliliters. It's because of that that I don't typically say in an MR report there's no joint effusion, because the clinician may see, wait, I see a little bit of fluid. So what I say is there's only a physiologic amount of fluid present in the joint. And effusion really is a pathologic condition, and indeed it can accompany a variety of processes. Typically, we can see effusion as a soft tissue density on the imaging study, particularly CT and MRI, but one of the tricks is to look at the effect that an effusion has on nearby fat. And to illustrate that, I'm going to show you this particular example in the knee, identifying the 3 fat pads, intracapsular extrasynovial fat pads on the anterior aspect of the knee. They're numbered here and listed 1, 2, and 3. So what you can see here, a physiologic amount of fluid separating fat pad the quadriceps and the prefemoral fat. That is normal fluid. Now, many years ago, Ferris Hall, who wrote a lot of articles on this, as well as letters to the editor, described a measurement that can be seen on lateral radiographs when you look at the distance between the 2 fat pads shown in the bottom. That distance is the collapsed suprapatellar pouch, and what he and his co-investigators suggested is that if you measure the width. Hello, everybody, and welcome back to another lecture. And as you can see from this particular slide, the name of the lecture is Diagnosing Articular Disorders, particularly those of synovial lined articulations, some tips and tricks. What I plan to do over a series of about 2 or 3 lectures is to cover this topic, utilizing a variety of imaging methods that will range from conventional radiography on one end to MR imaging on the other. But I've always believed when trying to diagnose articular disease and come up with a specific diagnosis, conventional radiography is better than MR imaging, the latter being better for determining the degree of involvement once you know the diagnosis. So having said that, I would let you know that we will be emphasizing conventional radiography during the next series of lectures, as I said, 2 or 3 in number. When we're trying to diagnose accurately articular disorders, particularly of synovial line joints, there are 2 particular features that we study. The first of these is the morphologic changes that we can appreciate using conventional techniques or occasionally advanced imaging methods. And there are a number of them. I've listed, in fact, about 9 or 10 on this particular slide. These are easy to understand if you know the gross pathology of the disease process. The second is the distribution of the abnormalities. Are the abnormalities symmetrical from one side to the other, asymmetrical? Are they unilateral? What specific joints are involved and what portions of joints? This relates to distribution, and that does require some memory, as an understanding doesn't always explain why we see specific joints or parts of joints involved. For this particular discussion today, we're going to look at part 1, morphology. And my particular objective for this lecture is to review the characteristic 7 morphologic features of some of the important rheumatologic disorders that affect the synovial joints of the peripheral skeleton. To give you an idea of what we're going to cover, I list here those 7 features. We'll go through them one by one, starting at the top with bone erosions. Bone erosions are a very important marker of a variety of disorders, particularly those that produce synovial proliferation